Hello, I'm Dr. James Wilson, and today I want to talk to you about something many men over 60 quietly worry about, but rarely feel comfortable discussing. If you've noticed changes in your intimate function, I want you to take a deep breath and let go of any embarrassment right now, because what you are experiencing is extremely common, and more importantly, it often has very little to do with age and much more to do with circulation and overall health. Many men believe that when things start changing in this area, it means they're getting old or something is wrong with their masculinity. The truth is far more practical and far less emotional than that. Your intimate function depends on blood flow, and when blood flow becomes affected, intimacy naturally becomes more difficult. But instead of seeing this as a loss, I want you to think of it as your body sending you a message, often years before a more serious cardiovascular problem shows up. That is why this conversation matters, because it's not just about intimacy, it's about your heart, your blood vessels, your nerves, and your long-term health. Research from the Massachusetts Male Aging Study shows that by age 70, nearly 70% of men notice some degree of difficulty. But what most men don't realize is that these changes can be the very first sign of developing cardiovascular issues. The reason is simple. The arteries involved in intimacy are tiny, much smaller than the arteries feeding your heart. And small arteries show problems first. In many cases, men experience erectile difficulty 3 to 5 years before a major cardiovascular event. So today, I want to give you clarity, reassurance, and a path forward. This video is not about judgment, shame, or sensitivity. I want you to understand what's happening in your body, why it's happening, and how you can support your circulation so that not only your intimacy improves, but your overall health improves too. And before we begin, please remember, this educational video is not a replacement for personal medical advice. Always speak with your healthcare provider before making changes to your health routine. To understand why circulation affects intimate function so powerfully, we need to look at the basics of how an erection forms. When a man becomes aroused, 4 systems work together: healthy blood vessels, good nerve function, appropriate hormone levels, and a responsive brain and emotional state. For now, let's focus on blood vessels because they play the central role. Inside the penis are 2 long chambers called the corpora cavernosa. Think of these chambers like small, expandable sponges. When you become aroused, your brain sends signals through the nerves to release a chemical called nitric oxide. This relaxes and widens the arteries, allowing blood to rush in. As the chambers fill with blood, pressure builds and compresses the veins that normally drain the area. This traps blood inside long enough to create and maintain an erection. This entire process depends on one thing: good circulation. Not perfect circulation, not athletic-grade circulation, just healthy, flexible, responsive blood vessels. But here's the challenge. The arteries in the penis are tiny. They measure about 1 to 2 millimeters. Meanwhile, the coronary arteries that supply your heart are 3 to 4 millimeters wide. Because the penile arteries are smaller, plaque buildup, inflammation, and stiffness affect them first. This means that erectile difficulties are often not just a bedroom issue, but a cardiovascular warning sign. Several studies, including research published in the Journal of the American College of Cardiology, confirm that erectile difficulties often precede heart disease by several years. So when a man experiences these changes, especially after age 60, it is not only reasonable, it is essential to evaluate circulation and cardiovascular health. Now let's address some common misunderstandings that cause unnecessary fear. Many men believe erectile changes are caused by low testosterone. That is a myth. Low testosterone affects libido, your desire, more than it affects the ability to achieve an erection. In fact, only 10 to 15% of erectile issues are mainly due to low testosterone. Another misconception is that medications don't help, so nothing can be done. That is also false. There are multiple treatment options, and often the best results come from combining lifestyle improvements with the right medical approach. But one of the most damaging beliefs is the idea that bringing this up with your doctor is embarrassing. Let me tell you something very clearly. Your doctor sees this as a health conversation, not a personal one. Erectile symptoms give doctors valuable insight into circulation, blood pressure, diabetes, and heart disease risk. You are not being dramatic by bringing this up. You are being responsible. Let's talk about why this becomes more important after 60. As you age, your blood vessels naturally become less elastic. Conditions like high blood pressure, high cholesterol, and diabetes become more common. More men begin taking medications that may affect intimacy, and tissues in the body naturally lose some sensitivity. In other words, multiple factors converge in this decade of life, making circulation more vulnerable. But the good news is that improvements in circulation have been shown to improve intimate function at any age. Even men in their 70s and 80s who adopt healthier habits often see meaningful improvements within a few months. That is because the body is always trying to heal, repair, and restore balance when given the right support. To understand what improves intimacy naturally, we need to explore the central biological mechanism: nitric oxide. When nitric oxide signals the arteries to relax, blood flow increases. But nitric oxide production depends on the health of the endothelium, the inner lining of blood vessels. When the endothelium is irritated, inflamed, or damaged, nitric oxide production drops, and blood vessels become less responsive. This is called endothelial dysfunction, and it affects up to 80% of men with erectile concerns. The biggest contributors to endothelial dysfunction are plaque buildup, high blood pressure, high blood sugar, smoking, inflammation, stress, poor sleep, and lack of physical activity. Inflammation is a major factor. Chronic inflammation gently erodes the lining of blood vessels, making them stiffer and narrower. Conditions such as metabolic syndrome, diabetes, obesity, and long-term stress all increase inflammation. A study in the Journal of the American Medical Association found that men with metabolic syndrome were 2.6 times more likely to experience erectile difficulties. High blood pressure also plays a direct role by damaging the very walls of the arteries, reducing their ability to expand. The Framingham Heart Study showed that men with high blood pressure were nearly twice as likely to have erectile difficulties as men with normal blood pressure. Diabetes deserves special attention because high blood sugar damages both nerves and blood vessels. Over time, poorly controlled diabetes reduces sensitivity, disrupts nerve signaling, and restricts blood flow. The American Diabetes Association reports that 35 to 75% of men with diabetes develop erectile concerns. Poor blood sugar control correlates strongly with increased severity. This is why improving glucose control improves sexual and cardiovascular function simultaneously. Now let's shift to what you can do, starting today, to improve circulation and support natural intimate function. Lifestyle changes are incredibly effective, and studies show they often produce improvements as strong as medication. Physical activity is the single strongest lifestyle factor. Exercise improves blood vessel flexibility, increases nitric oxide production, reduces inflammation, improves insulin sensitivity, lowers blood pressure, and helps with weight control. A major study in the Journal of Sexual Medicine followed 600 men for 2 years and found that those who exercised regularly saw marked improvement in erectile function, while inactive men saw steady decline. You don't need to run marathons. 30 minutes of brisk walking 5 days per week is enough. If that feels too difficult, start with just 10 minutes of walking after meals. This habit alone improves blood flow and helps glucose control. Strength training 2 to 3 times per week also helps. Simple exercises like wall push-ups, chair squats, and resistance band movements can noticeably improve circulation within a few months. Diet is the second most powerful factor. The Mediterranean eating pattern, rich in vegetables, fruits, whole grains, fish, lentils, olive oil, and nuts, consistently shows improvements in both cardiovascular and intimate function. A study published in the American Journal of Clinical Nutrition found that men following a Mediterranean diet improved erectile function even before losing weight. That's because this way of eating reduces inflammation and improves endothelial health. Some foods have specific benefits, such as watermelon, which contains citrulline, a precursor to nitric oxide, dark chocolate with 70% cocoa, which improves blood flow, leafy greens, rich in nitrates that convert to nitric oxide, and nuts such as walnuts and almonds, which support artery health. On the other hand, processed foods, sugary snacks, excessive alcohol, and deep-fried foods worsen circulation. Weight management also plays a significant role. Fat stored around the stomach increases inflammation, reduces circulation, and lowers testosterone. Losing just 10% of your body weight can significantly improve erectile function, meaning a 200-pound man could see real improvements after losing just 20 pounds. Smoking is another major factor. Cigarette smoke reduces nitric oxide, stiffens arteries, and narrows small vessels. Quitting smoking often improves erectile function in just 2 or 3 months. Alcohol also affects intimacy. More than 2 alcoholic drinks per day can reduce testosterone, impair nerve function, and reduce circulation. Cutting back often leads to improvements in both energy and intimacy. It's also important to understand how medical conditions impact circulation. High blood pressure stiffens arteries and reduces the ability to build pressure in the erectile chambers. Diabetes damages nerves and blood vessels. High cholesterol accelerates plaque buildup. Sleep apnea decreases nighttime oxygen, damaging blood vessels and reducing nitric oxide. Depression and anxiety change brain chemistry, reduce desire, and interfere with arousal. Heart disease and erectile issues share the same underlying cause, damaged blood vessels. Many medications, including older blood pressure drugs and certain antidepressants, can also affect intimate function. Never stop a medication without speaking with your doctor first. There are often safer alternatives. When discussing circulation and intimate health, it's important to understand how medical treatments fit into the bigger picture. Many men jump straight to medications because they see them as a quick fix. But the truth is that medications work best when the underlying circulation is also being supported. Let's talk about these treatments gently and clearly, because understanding them helps you make informed choices. The medications most commonly used for erectile improvement work by enhancing the nitric oxide pathway, the same natural pathway your body uses during arousal. They don't create desire, and they don't automatically cause an erection. Instead, they allow the arteries to relax more effectively when you are already aroused. In other words, they assist your natural process. Medications like sildenafil, tadalafil, vardenafil, and avanafil are proven to help about 70% of men. Some men respond better to one medication than another. So if one doesn't work well for you, it doesn't mean none will. It may simply mean you need a different dosage or a different medication. But before using these medications, there are essential safety considerations. Men who take nitrate medications for chest pain or certain heart conditions cannot use these intimacy medications because combining them can lead to dangerously low blood pressure. Men with severe heart disease also need medical evaluation before starting these treatments. This is why speaking with your doctor matters. Not to be judged, not to be teased, but to protect your health. A doctor can evaluate your heart, blood pressure, and circulation to ensure the medication is safe and appropriate. Many men avoid this conversation out of embarrassment, but your doctor is far more concerned about your cardiovascular safety than anything else. These medications can be incredibly helpful, but they cannot fix circulation problems on their own. They work best when lifestyle, blood pressure, cholesterol, blood sugar, and stress are also being managed. Another treatment option is testosterone replacement, but this requires careful discussion. Testosterone doesn't directly cause erections. Instead, it influences desire, motivation, well-being, energy, and mood. Men with very low testosterone often feel fatigued, unmotivated, depressed, or disconnected, and restoring testosterone can help improve overall quality of life. But testosterone replacement is only appropriate when blood tests confirm truly low levels and when symptoms match the deficiency. It also requires regular monitoring of your blood count, prostate health, and cardiovascular status. Some men benefit greatly, while others may improve circulation and intimate function without testosterone at all. This is why individualized care is critical. There are also treatments that address the local blood flow directly. Vacuum erection devices, for example, use a gentle vacuum to draw blood into the penis. They are safe, non-invasive, and effective for many men, especially those who cannot take medications. Some men find them awkward at first, but with practice they become easier to use. For others, penile injections may sound intimidating, but they are surprisingly effective and not as painful as most imagine. These inject medications directly into the erectile tissue to cause an erection. This treatment works even when the nerves or blood vessels are significantly impaired, and many men appreciate the reliability it offers. There are also urethral suppositories and more advanced treatments like shockwave therapy, which aims to stimulate new blood vessel growth. These are not right for everyone, but they are valuable options for men whose circulation needs stronger intervention. But the goal of this video is not simply to list treatments. The goal is to help you understand your body and to give you the confidence to take steps toward better circulation, better health, and better intimacy. And that begins with practical daily actions. The kind of actions you can start today, at home, without money, without equipment, and without stress. So let's shift into the daily habits that support your circulation naturally. The first and most important step is scheduling a comprehensive checkup with your doctor. This is not a visit about embarrassment. It's a visit about your heart, your brain, your blood vessels, and your overall health. When you talk to your doctor, be direct. Say something like, "I've noticed changes in my intimate function, and I'd like to check my circulation and cardiovascular health." Your doctor will not judge you. They will appreciate your honesty, because these symptoms tell them information that no scan or test can reveal alone. At this checkup, your doctor will measure your blood pressure, which is one of the most important indicators of erectile and heart health. They may order blood tests including fasting glucose, HbA1c, cholesterol levels, testosterone, kidney function, and thyroid function. They may ask about your medications because many common prescriptions affect intimacy. Even something as simple as switching from one blood pressure medication to another can make a difference in some men. It also helps to prepare before your appointment. Write down when your symptoms started, how often they happen, whether you still have morning erections, whether stress or fatigue makes things worse, and what medications or supplements you take. Morning erections, for example, can help your doctor determine if the issue is more physical or more psychological. If morning erections are present, circulation is usually still functional, and stress, anxiety, or medication effects might be playing a larger role. These details help your doctor pinpoint the source of the problem with far more accuracy. While medical evaluation is essential, the biggest improvements often come from consistent lifestyle steps. Increasing physical activity, for example, improves circulation faster than most people expect. If you haven't exercised in a while, begin with small steps. Walk for 10 minutes after each meal. This simple habit improves blood flow, reduces blood sugar spikes, supports weight control, and reduces inflammation. Over time, try to build up to 30 minutes of daily activity. If walking is difficult, consider swimming, cycling, dancing, or even simple home aerobics. The specific exercise matters less than consistency. Even gardening, mowing the lawn, and household chores count toward your activity goals. Alongside aerobic activity, building strength is also important. You don't need a gym membership. You can use your own body weight. Chair squats strengthen your legs and increase lower body circulation. Wall push-ups strengthen your chest and arms and help with oxygen delivery to your tissues. Light dumbbells or resistance bands can help improve muscle mass, which is crucial for maintaining healthy hormone levels and insulin sensitivity. The stronger your muscles, the better your circulation becomes, and the less strain is placed on your heart. Dietary changes are equally powerful. Instead of focusing on what you cannot eat, start by adding healthy foods. Add a serving of vegetables to your dinner. Replace white bread with whole grain bread. Switch from sugary drinks to water or unsweetened tea. Include fish twice per week instead of red meat. Replace butter with olive oil. Eat nuts such as almonds or walnuts as snacks instead of processed snacks. These small steps help reduce inflammation and support the inner lining of your blood vessels. Over time, your blood vessels become more responsive, allowing more nitric oxide, more flexibility, and better blood flow. If you smoke, I want to speak to you gently for a moment. Smoking damages the small arteries essential for intimate function. Even light or occasional smoking affects nitric oxide production. If you have tried to quit before and struggled, please don't feel discouraged. Quitting is difficult, but it is possible, especially with support. Talk to your doctor about nicotine replacement therapy, medications, counseling programs, or local quit lines. Many men see improvements in circulation and erectile function within just a few months of quitting. Alcohol is another factor worth mentioning. A drink or two occasionally is fine, but drinking more than 2 drinks per day can interfere with nerve function, reduce testosterone, and impair circulation. Cutting back to moderate levels can help improve both energy and intimacy. If you're drinking heavily to cope with stress, loneliness, or boredom, consider reaching out to someone or exploring healthier coping strategies. You're not alone, and support is available. Stress management is something many men overlook, yet chronic stress directly affects intimacy. Stress increases cortisol, which reduces testosterone, tightens blood vessels, and interferes with arousal. Even 10 minutes of deep breathing, gentle stretching, meditation, or quiet reflection can help. Spending time outside, talking with loved ones, and enjoying hobbies all reduce stress hormones. Better sleep also plays a major role. Poor sleep reduces nitric oxide, increases inflammation, and impairs hormone regulation. If you snore loudly, wake up tired, or struggle with daytime sleepiness, ask your doctor about sleep apnea screening. Treating sleep apnea not only improves heart health, but often improves erectile function as well. These lifestyle changes don't transform your health overnight, but they create steady, reliable improvement. Think of your body like a garden. When you water it, nourish it, remove the weeds, and protect it from harm, it begins to revive. Slowly at first, then noticeably. Your circulation works the same way. Small daily habits build stronger arteries, healthier nerves, calmer emotions, and better overall function. As you move forward, try to stay patient with yourself. Many men feel discouraged when they don't see results immediately, but circulation takes time to improve. Most lifestyle changes require 8 to 12 weeks before you notice the benefits, and those months are worth the wait. Keep track of small successes, such as feeling more energy, sleeping better, walking longer, or noticing subtle improvements in intimacy. These small steps show that you're moving in the right direction. Let's take a moment now to reflect on everything we've covered throughout this full conversation. Changes in intimate function after age 60 are common, but they should never be ignored. They are often early signs that your circulation needs attention. The same arteries responsible for intimacy are the first ones affected by high blood pressure, diabetes, smoking, high cholesterol, poor diet, and lack of physical activity. That's why addressing these concerns is not just about improving your intimate life. It's about protecting your heart, your brain, and your future. You now understand how blood vessels, nerves, hormones, stress, sleep, and circulation all work together. You understand why nitric oxide matters, and why the endothelium, the inner lining of your blood vessels, must be protected and strengthened. You understand why exercise, healthy eating, weight control, smoking cessation, and stress reduction can dramatically improve both circulation and intimacy. You also understand the important role of medical evaluation, screening, and treatment options when needed. I want you to take this information not as a source of worry, but as a source of empowerment. You now know what your body is telling you. You now know what steps to take. You now have the confidence to talk openly with your doctor and to take control of your health. Improving circulation improves intimacy, but it also improves your energy, your sleep, your mood, your long-term well-being, and your quality of life. And that brings us to the end of this video. If you found this helpful, please subscribe to Senior Vitality Clinic and share this video with someone who may benefit from it. Remember, you are not alone, you are not broken, and with the right support, your body can improve at any age. Thank you for spending this time with me today. Take care of yourself, stay consistent with your daily habits, and I'll see you in the next video.